4,452 lives lost in a single year. That's the grim number behind Ohio's growing drug nightmare. And the reality is even more disturbing than the headline. Synthetic opioids, hidden drug mixtures, and a rapidly changing street supply are turning ordinary use into a deadly gamble. Emergency responders are racing against overdoses happening faster than ever before. Communities are searching for answers while the crisis quietly spreads. What's really driving these deaths, and why are so many lives still being lost across Ohio today? Number 1. Synthetic opioids flooding the streets, especially fentanyl. Unlike traditional opioids such as heroin or prescription painkillers, fentanyl is extremely potent, about 50 times stronger than heroin and 100 times stronger than morphine. This tiny but powerful drug is often produced illegally in clandestine labs and mixed into other substances before reaching the streets. Many people who think they are buying heroin, cocaine, or even counterfeit prescription pills are unknowingly consuming fentanyl. That hidden presence dramatically increases the risk of fatal overdose, since even a small dose measured in micrograms can shut down breathing within minutes. Across Ohio, law enforcement agencies and health officials continue to report that fentanyl now dominates the illicit opioid supply. The danger grows because fentanyl is rarely sold alone. Drug traffickers frequently mix it with heroin, cocaine, methamphetamines, and counterfeit oxycodone pills, creating unpredictable and highly dangerous drug combinations. Users often have no way of knowing the exact strength of what they are taking. One batch might be weaker, while the next could contain lethal concentrations capable of causing instant overdose. This unpredictability makes the current drug market far deadlier than earlier phases of the opioid epidemic. Communities across Ohio are witnessing the consequences daily. Emergency responders regularly administer naloxone, a medication that reverses opioid overdoses, yet many overdoses happen too quickly for help to arrive in time. Number 2. Polysubstance drug use, deadly drug combinations. A growing driver of overdose deaths in Ohio is polysubstance use, a pattern where people consume multiple drugs at the same time or within a short period. This trend has become increasingly common across many communities, turning already dangerous substances into far more lethal combinations. When drugs interact inside the body, their effects often multiply rather than simply add together. Opioids that slow breathing can become far deadlier when mixed with depressants such as benzodiazepines or alcohol. At the same time, stimulants like cocaine or methamphetamine may mask warning signs of overdose, making users believe they can tolerate higher doses than their bodies can handle. Many individuals do not intentionally mix these substances. Street drugs are frequently contaminated during manufacturing or distribution, meaning a person might think they are using a single drug while unknowingly consuming several. Fentanyl has been discovered in cocaine, counterfeit pills, and other illicit drugs, dramatically increasing overdose risk for people who do not normally use opioids. The hidden nature of these mixtures creates a dangerous environment where every dose carries unpredictable consequences. Medical examiners across Ohio increasingly report multiple substances present in toxicology results after fatal overdoses. This pattern shows how modern drug markets have shifted toward complex chemical mixtures, making prevention and treatment far more challenging. Number 3. Rise of cocaine and stimulant-related overdose deaths. Another alarming shift in Ohio's drug crisis is the sharp rise in cocaine and stimulant-related overdose deaths. While the opioid epidemic has dominated headlines for years, stimulants such as cocaine and methamphetamine are quietly driving a second wave of fatalities. Public health reports show that overdose deaths involving cocaine have increased across several counties, signaling that the crisis is no longer limited to opioid addiction alone. These drugs stimulate the central nervous system, raising heart rate, blood pressure, and body temperature. In high doses or when used frequently, they can trigger heart attacks, strokes, or severe organ failure within minutes. The danger becomes even greater because cocaine today is often contaminated with synthetic opioids, especially fentanyl. A person expecting the stimulant effects of cocaine may unknowingly ingest a powerful opioid at the same time. Since many stimulant users do not have opioid tolerance, even a tiny amount of fentanyl can overwhelm their bodies. This hidden contamination has turned recreational drug use into a life-threatening gamble. Emergency responders across Ohio have reported more overdose calls involving people who believed they had taken only cocaine. Toxicology reports later reveal a deadly mixture of stimulants and opioids. This evolving pattern shows how the drug landscape is shifting, spreading overdose risks into entirely new populations. Number 4. Prescription opioid legacy and addiction pipeline. The roots of Ohio's overdose crisis stretch back to the widespread prescription opioid boom of the early 2000s. For years, powerful pain medications such as oxycodone and hydrocodone were prescribed at extremely high rates for injuries, surgeries, and chronic pain. Pharmaceutical marketing and changing pain treatment guidelines encouraged doctors to treat pain aggressively, often with long-term opioid prescriptions. Many patients initially used these medications as directed, believing they were safe because they came from a pharmacy. Over time, repeated exposure created physical dependence, meaning the body began to rely on the drug just to function normally. When stricter prescribing regulations eventually reduced access to these medications, many dependent individuals were suddenly left without the substances their bodies had adapted to. Withdrawal symptoms can be intense, including severe pain, nausea, anxiety, and insomnia. Faced with those symptoms, some people turn to the illegal drug market searching for cheaper or more accessible alternatives. Heroin became a common substitute because it produced similar effects at a lower cost. That shift unintentionally opened the door to an even more dangerous stage of the epidemic. Illicit opioids like heroin soon became mixed with fentanyl, dramatically increasing overdose risk. What began as prescription pain treatment gradually evolved into a widespread addiction pipeline feeding today's synthetic opioid crisis.
Number 5. Mental health crisis and substance use disorders. Behind many overdose statistics lies a growing mental health crisis affecting communities across Ohio. Conditions such as depression, anxiety, post-traumatic stress disorder, and chronic stress often push individuals towards substance use as a way to cope with emotional pain. Drugs can temporarily numb difficult feelings, offering a short escape from overwhelming thoughts or traumatic memories. Over time, that coping mechanism can evolve into dependency, especially when substances repeatedly trigger the brain's reward system. The relief may be brief, yet the brain begins associating drugs with comfort or emotional stability. Mental health challenges frequently go untreated due to stigma, lack of resources, or limited access to professional care. In many communities, people struggling with psychological distress hesitate to seek help because they fear judgment or social consequences. Without proper therapy or support systems, self-medication with drugs or alcohol becomes a common response. This cycle creates a dangerous connection between emotional suffering and substance misuse. When addiction and mental illness exist together, the risks become even greater. Individuals dealing with both conditions often experience unstable moods, impaired decision-making, and reduced ability to recognize overdose warning signs. Treatment also becomes more complex because both issues must be addressed at the same time. Without integrated care and long-term support, recovery becomes significantly harder to achieve.
Number 6. Economic stress and post-industrial decline. Economic hardship has played a powerful role in shaping Ohio's drug crisis. Many communities across the state experienced major industrial decline over the past several decades as factories closed and manufacturing jobs disappeared. Towns that once depended on steel mills, automotive plants, and other industries suddenly faced rising unemployment and shrinking local economies. When stable jobs vanish, the ripple effects spread quickly through families and neighborhoods. Financial stress, housing instability, and uncertain futures can create emotional pressure that increases vulnerability to substance misuse. For some individuals, drugs become a temporary escape from the frustration of lost opportunities and economic insecurity. Feelings of hopelessness often grow in regions where job prospects remain limited and younger generations see fewer pathways towards stability. Communities dealing with long-term poverty also face reduced access to healthcare, mental health services, and addiction treatment programs. Without those resources, prevention and recovery efforts become far more difficult to sustain. Researchers studying addiction patterns have repeatedly found strong connections between economic distress and rising overdose deaths. Areas with higher unemployment and declining industries frequently report greater substance use disorders. Economic hardship does not directly cause addiction, yet the stress, uncertainty, and lack of opportunity can create conditions where drug use spreads more easily across vulnerable populations.
Number 7. Limited access to treatment and rehabilitation. Access to effective addiction treatment remains a major challenge across many parts of Ohio. Thousands of people struggling with substance use disorders want help, yet treatment services are often limited, especially in rural or economically struggling communities. Rehabilitation centers, detox facilities, and long-term recovery programs may be located hours away from where patients live. Transportation barriers, waiting lists, and high treatment costs can prevent individuals from entering programs when they need help the most. Addiction is a condition that often requires immediate intervention, yet delays in treatment can allow the disorder to grow more severe. Another challenge involves the shortage of trained professionals who specialize in addiction medicine and behavioral health care. Counselors, psychiatrists, and recovery specialists are essential for guiding people through withdrawal, therapy, and long-term recovery plans. When communities lack enough qualified providers, individuals may receive only partial care or none at all. This gap in services leaves many people struggling without proper medical supervision or psychological support. Recovery is rarely a short process. It requires ongoing therapy, medication-assisted treatment, community support, and stable living conditions. Without consistent access to these resources, relapse becomes far more likely. When treatment systems cannot meet demand, addiction continues spreading while preventable overdose deaths keep rising across vulnerable communities.
Number 8. Rapidly changing illegal drug supply. One of the most dangerous features of today's drug crisis is the rapidly changing illegal drug supply. The substances circulating through Ohio's streets are no longer consistent in strength, composition, or origin. Drug traffickers frequently alter chemical formulas, introduce new synthetic compounds, or mix substances in unpredictable ways. This constant change creates an environment where users rarely know what they're actually consuming. Even experienced users who believe they understand their tolerance levels can suddenly encounter far stronger or entirely different drugs than expected. Synthetic substances have made this problem even more severe. Many modern drugs are produced in clandestine laboratories where chemical variations can appear from batch to batch. A shipment that appears similar to the previous one may contain a dramatically higher concentration of active ingredients. In some cases, a single pill or small amount of powder can contain a lethal dose without obvious visual differences. These variations make it extremely difficult for users to judge safe amounts. Public health officials and law enforcement agencies often struggle to keep up with these rapid changes. By the time authorities identify a new synthetic drug or chemical mixture, it may already be spreading through multiple communities. This unpredictable supply chain increases overdose risks and complicates prevention efforts across the state.
Number 9. Pandemic-era disruptions to addiction treatment. The COVID-19 pandemic created disruptions that deeply affected addiction treatment systems across Ohio. Lockdowns, social distancing rules, and overwhelmed healthcare facilities forced many treatment centers to reduce services or temporarily close their doors. Support structures that people relied on, including group therapy sessions, recovery meetings, and in-person counseling, suddenly became harder to access. For individuals already struggling with substance use disorders, the sudden loss of these support networks created dangerous gaps in care. Isolation also played a powerful role during the pandemic period. Many people spent long periods alone at home, separated from friends, family members, and recovery communities that normally helped keep them accountable. Substance use often increases during isolation because there are fewer social barriers and fewer people who can notice warning signs. If an overdose occurs while someone is alone, the chances of receiving immediate medical help drop dramatically. Economic uncertainty during the pandemic also intensified stress levels. Job losses, financial instability, and anxiety about health risks created emotional strain for many households. These pressures can increase vulnerability to substance misuse, particularly for people already facing addiction challenges. While some services eventually adapted through telehealth and remote counseling, many individuals struggled to reconnect with treatment programs after months of disruption and instability.
Number 10. High overdose rates compared to other states. Ohio continues to report one of the highest overdose death rates in the United States, reflecting how deeply the drug crisis has affected the state. For years, public health data has placed Ohio among the hardest-hit regions, with thousands of lives lost annually. These numbers reveal more than isolated incidents. They show a persistent pattern where overdose deaths remain elevated despite prevention campaigns, law enforcement efforts, and expanded treatment programs. Communities across urban and rural areas alike continue to experience the devastating impact. Several factors contribute to these unusually high rates. Ohio's location places it along major drug trafficking corridors that connect large metropolitan markets in the Midwest and East Coast. This geographic position allows illegal drug supplies to move quickly through the state. When highly potent substances such as fentanyl enter these networks, they spread rapidly across multiple counties. High availability combined with existing addiction levels creates conditions where overdose risks escalate quickly. Health officials also point to long-standing socioeconomic pressures, healthcare gaps, and the lingering effects of earlier opioid prescribing trends. Together, these elements form a complex environment where addiction remains difficult to control. As a result, Ohio's overdose statistics continue to stand out nationally, showing how persistent and widespread the crisis remains today.
Ohio's drug crisis reveals a complex web of synthetic opioids, shifting drug markets, mental health struggles, and economic pressures colliding at the same time. Each factor alone is dangerous, but together they create a situation where overdose risks multiply across communities. Behind every statistic are families, neighborhoods, and first responders facing the consequences daily. Understanding these causes is an important step toward prevention, stronger treatment systems, and better awareness of how quickly the drug landscape continues to evolve. The crisis did not appear overnight, and solving it will require coordinated action, education, and long-term recovery support. If you found this breakdown valuable, like the video and subscribe to the channel for more deep dives into important issues shaping our world. Share your thoughts in the comments. What solutions do you think could help reduce overdose deaths? And if you want more research-based investigations like this, check out the next video on the channel.